Hello and welcome to another episode of Let's Talk Health. Today's session will be on pancreatitis, and to discuss this, we have with us Dr. Raghavendra, consultant medical gastroenterologist, Citizens Hospital, Shelingapalli, Hyderabad. Good evening, doctor.
Good evening, sir.
So, before we start with the questions, I would request you to give our viewers a glimpse of your expertise.
Hello, viewers. I have been working in this field of pancreatitis for the past 13 years. I have a huge experience in dealing and treating these cases. I am well versed with all the advanced techniques like ERCP, endoscopic ultrasound guided interventions, pancreatoscopy, and lithotripsy techniques.
So, coming to the questions, doctor. My first question is, what is pancreatitis, and can you explain the key cause and risk factors associated with this condition?
Pancreatitis is basically inflammation of the pancreas. Inflammation is the body response to injury or to any organ. So the key factors or the causes for this pancreatitis are gallstones and alcohol. These contribute to 80%. Other causes are high lipids and high calcium. Sometimes genetic causes. Some drugs can cause pancreatitis.
So, coming to my second question, sir, are there different types of pancreatitis, and how do they differ in terms of symptoms and causes?
Depending on the onset of symptoms and the duration of the illness, a requirement of the hospitalization and ICU stay. So the pancreatitis can be divided into acute and chronic. Acute, the symptom onset will be within hours, 2 days. Whereas in chronic, the symptom onset will be over a period of months to years. For acute pancreatitis, the main causes are alcohol and gallstones, high triglycerides, high calcium. Whereas for the chronic pancreatitis, the most important cause is alcohol and genetic causes and structural anomalies.
So, coming to my third question, doctor, how is pancreatitis diagnosed, and what tests are typically involved in the diagnostic process?
Okay, so the pancreatitis is diagnosed by fulfilling 2 out of the 3 criteria. The first one is typical pancreatic pain, a very severe pain starting in the upper abdomen, radiating to the back, associated with vomiting. And added to this typical pain, the other 2 criteria will be either amylase or lipase, more than 3 times elevation, or imaging tests like CT, MRI showing evidence of involvement of pancreas.
So, coming to my next question, doctor, what are the common symptoms of pancreatitis, and how can individual differentiate it from other digestive issues?
The common symptoms of pancreatitis are abdominal pain. The abdominal pain will be very severe, starting in the upper abdomen, radiating to the back, and associated with the vomitings. The pain will be so severe, the patient has to bend forward to get a little bit relief of pain. So other causes of abdominal pain will not be that severe. And in case of chronic pancreatitis patients, there can be other symptoms like flatulence, change in frequency of the stools, oil in the stools, and they can also have symptoms of diabetes also.
So, the next question is, doctor, can you discuss the role of diet and nutrition in managing and preventing pancreatitis? And are there any specific dietary recommendations?
In case of acute pancreatitis, there are no special diets. In the acute phase, the patient will be having severe pain, which is aggravated by eating. So the patient will be kept nil by oral and on only IV fluids for the initial part of the period until the pain subsides. And once the pain subsides, there won't be much dietary restrictions. In case of chronic pancreatitis, since they are unable to digest fats, if the patient is not taking any pancreatic enzyme replacements, he is advised to go on a low-fat diet, that is less than 20 grams per day of fat.
So, the next question, doctor, what treatment options are available for acute pancreatitis, and how do they differ from those from chronic pancreatitis?
So, the treatment options for acute and chronic pancreatitis are both different. In case of acute pancreatitis, the treatment is mainly targeted in identifying the severe cases and preventing the other organ failures, and if the other organ failures occur, supporting the other organ systems. In case of chronic pancreatitis, the management aspect will be more towards the maldigestion and the malabsorption. So here the pancreatic enzyme replacement therapy and supplementation of nutrients will play a major role. In case of pancreatitis caused by any gallstones causing blockade of the pancreas, the other interventions like ERCP may be done. In case of chronic pancreatitis, there can be stone formation, and when these stones they block the duct, the patient can have pain. So in order to relieve the stones, the various therapeutic options like ERCP, lithotripsy can be done.
So the next question is, doctor, are there medications or therapies that can help manage the symptoms and pain associated with pancreatitis?
Yeah, in case of acute pancreatitis, the pain will be so severe and which is not relieved by the regular pain medicine. So in such cases, the opioid analgesics like fentanyl, morphine are used to have relief of pain. And in case of chronic pancreatitis, since they have to take the pain medications for a long term, and these long-term usage of these medications are going to be having side effects, so they can be offered other kinds of therapy like celiac plexus block, by which the pain can be managed.
So the next question is, doctor, can you elaborate on the potential complications of pancreatitis, including pancreatic cirrhosis and organ failure?
Okay, so the pancreatitis, when it gets injured, the digestive enzymes get released within the pancreas, leading to autodigestion of the pancreas. This pancreatic enzyme digestion of the pancreas can lead to release of some chemicals which can affect other organs and leading to their organ failure. So the other organs can be salvaged by supporting them, like respiratory support by means of a ventilator, or supporting the kidneys by using dialysis, and supporting the heart by using inotrope medication. And sometimes there can be a local complication. The pancreatic juice can get collected within the pancreas, forming a pseudocyst, or the pancreatic juice along with the dead pancreatic tissue, which is called necrosis, can get collected in the form of a collection, which is called wall of necrosis. So both of the pseudocyst and wall of necrosis, they give a feeling of fullness. The patient is unable to eat, and the patient can have severe pain, and patient can have vomitings. If the patient is symptomatic because of this pseudocyst or one, they require drainage, either endoscopically, percutaneously, or by surgical means.
So coming to my next question, doctor, what are the endoscopic options for treating severe cases of pancreatitis, and where are they typically recommended?
The endoscopic options are recommended when the patient is symptomatic because of the complications. So various endoscopic options are endoscopic ultrasound guided pseudocyst drainage and endoscopic ultrasound guided wand drainage. And if the patient has an infected necrotic collection, even necrosectomy can be done through endoscopy.
So coming to the last question, doctor, for the day, how does alcohol consumption relate to the development of pancreatitis, and what lifestyle changes can individuals make to reduce their risks?
Alcohol, if taken in very less quantity, it won't be a problem. But if it is consumed in too much quantities, the liver and pancreas have to step in to metabolize the alcohol. So there it causes the trouble. So if a patient takes acutely very large amounts of alcohol, there is a chance for acute pancreatitis. And if the patient takes alcohol over a period of years, he can develop chronic pancreatitis. So it's better to avoid alcohol.
Thank you, doctor, for your valuable time and inputs. So with this, we conclude today's episode of Let's Talk Health, and we'll be back with another episode next week. Till then, take care, be safe. Thank you.
Thank you.